Hello and thank you for having us. I'm Dr. Donato. I'm a street medicine physician on behalf of Gene York, our founder, and Sarah Luber. Thank you all for being here. The homeless community has very significant barriers to access, barriers that we all don't share. To get health care in 2021, you need a phone, you need transportation, you need to have good language skills, and this population, from us coming out and meeting them, has had big time barriers in getting over those things. We are overjoyed to have gotten some help now to build a kiosk to make telehealth a real part of their lives. In coming out here, that we come out every 2 weeks, we now can have the opportunity of seeing all of these patients on Monday through Friday on a regular basis, to follow up things that we found, to have a quick care access without needing an additional phone or transportation. We can actually see them and get them the care that the rest of the world actually already has. So I'd like to thank both First Energy and United Way for having the foresight and help to build this, and especially Disha Dixon for leading us in a very tough financial time to seeing the way and putting together a very awesome extension of our healthcare. Thank you so much, and it's making a huge difference in a lot of lives in this community.
Good afternoon. My name is Kate Thornton, and I'm president of the Reading Hospital Foundation, and I'm really honored to be here today. You know, the best part of my job is seeing hard work and partnership come together to see a project like this happen. So I just want to talk a little bit about how did we get here, and it was COVID. You know, when COVID shut the whole world down, people stayed home. Kids didn't go to school. There was no food or toilet paper in the grocery store. You couldn't go to the mall. I mean, really, life stopped. But what didn't stop were our patients. People were still sick. People still needed care. And so our street medicine team, they were like, how are we going to deliver care in this type of pandemic? And so there was a lot of brainstorming that went on. And Disha started doing some research. And that research resulted in a kiosk, telemedicine. And I'm sure you've heard in the newspaper and if you're watching the TV, there's been a lot of talk about how telemedicine has really come to the forefront because of the pandemic. And we thought we could utilize that here and give care through it. So it was a great concept, but how were we going to make it happen? And so there were a couple of great partners that made it happen. So the foundation applied to First Energy Foundation and got a grant. So we knew we had the funds to build it. And then we needed a place to put it. So Hope Rescue Mission, Rob Turchi, said, yes, please put it here. And then next we needed staffing. It was great to have the kiosk and a place to put it, but if we were really going to open care and take away those barriers, we needed staffing to do it. And so the United Way, through their impact grant, gave us the funding for 3 positions. So we now have a program coordinator, we have a nurse, and we have a nurse practitioner, so that we can give care all the time when it's needed, not just on certain days of the week. And what I want to emphasize is that our physicians give care by volunteering their time and their talents. And so they're over at the hospital and coming over in the city of Reading, and they have different locations every week, but it really isn't enough. And so this kiosk will really make that happen. But the last part is really our team at the Reading Hospital and at Tower Health. This could not have happened without them coming together and ensuring that we had compliance and we had IT and we were installing it correctly, and that our Epic system was talking to the main system at the hospital. So it became possible for the project to happen, for all of these people to come together. And that's really a wonderful thing. And I also want to thank Disha Dixon, because it's really her leadership and her vision that has grown a very small program to what it is today, giving care to the underserved in our community. So thank you to all of our partners for being there for us. We really appreciate it, and I think we're all making a difference together. Thank you.
Hi everybody, I'm Mark, aka Cowboy. When I first started coming here, I started receiving help from street medicine. I I was seeing Tracy David's she was a big influence to me with how I got transitioned into Tower Health. I then met Darla, who took over for Tracy, and even though there was a difficult transition, the transition for me was just absolutely easy. Street medicine has helped me with all different types of accesses with eye exam, orthopedic issues, and stabilizing my medication. I specifically have seen Dr. Donato and Dr. Wolf, but prior to that, I had no stable health care at all for approximately 2 to 3 years. So they've helped me tremendously. I've also been able to encourage people that are here at Hope Center to have that ability to see Tracy or to see Darla and Yuri and get the health care that we need. So I encourage that with street medicine and telehealth. It's been a life-changing experience for me. I thank you all for volunteering all of your time. It's been a very fortunate and very understanding time for me. Thank you.
Welcome everyone to the mission. My name is Rob Turchi. I'm the Executive Director, and on behalf of my team here and on behalf of the over 1,000 different individuals that come here for help in a time of great need, I want to say thank you all. It is wonderful to see all the different faces that are friends of the mission and the agencies and organizations that they represent collaborating to bring this together. I consider myself street medicine's biggest fan, and that is because I've seen firsthand what the street medicine team has done for so many individuals. I personally have seen the street medicine doctors and nurses come in here and help men at their lowest points of time in life literally get all aspects of their health stabilized. I've seen street medicine save men's limbs because of intervening in their lives with things like wound care and other types of things that have literally saved men's lives and saved men's health. I have been out on the street from 11 p.m. to 2 a.m. with the street medicine team, walking around the streets of Reading and the parks, engaging the unsheltered and seeing the street medicine team offer critical services to those most in need that are unsheltered. We're finishing up our 127th year here at the mission, and we offer a safe place to stay, meals, clothing, job opportunities, but we are not addiction medicine specialists. We are not psychiatry specialists. We are not healthcare specialists, nor could we ever be. But the partnership that's symbolized by this ceremony this morning is just a beautiful partnership where the qualified professionals can come together and meet men from the community who otherwise might not be treated and have a good, safe place to engage them and help them stabilize their health and all aspects of their health. So I just want to say thank you so much. We appreciate you so much. You are welcome partners here. We welcome you here all the time, and so we're very grateful for you.